Now on the record, here begins the deposition of Robert Robinson, MD. Today's date is October 29th, 2019. Time on the video monitor is 1:08 p.m. Would the court reporter please swear in the witness?
Raise your right hand, please. You solemnly swear from the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Dr. I'm Doolin Kelly, and I represent the estate of Michelle Phillips.
Good afternoon.
Same to you. You realize you're not being sued. Nobody said you did anything wrong. We started off that way. Do you understand that?
I do.
Okay. Tell me, I don't have your CV. Just tell me a little bit about your professional education and professional career.
Pre-medical school, Murfreesboro, Middle Tennessee MTSU. Medical school, University of Tennessee in Memphis. Year of internship at what was then Baptist Hospital, now St. Thomas Midtown in 1983. And then started practicing emergency medicine at St. Thomas Midtown and Rutherford County in '84 and various clinics.
So have you been hospital-based ER, or did you do something else other than hospital ER practice?
Strictly hospital ER with maybe a year or two in outpatient clinics,
Okay.
Walk-in clinics.
How long did you work at St. Thomas Midtown Hospital, and you may still work there?
Still work there. It's been about 35 years.
Oh, really? That's a long time. So it was Baptist then when you first started there?
Correct.
Okay. All right. Tell me a little bit about Mrs. Phillips. Do you remember her at all?
I do not.
All right. I didn't expect that you would. I have provided you with the record for Mrs. Phillips there. And I've only found about 4 pages in there that I think you authored that had something to do with her care. I mean, I gather that you were an emergency room physician when she came in that day.
Correct.
All right. And I want you to turn to page 1003.
How are these numbers?
See that?
I haven't.
And I notice about halfway down, or a little bit more than that, it looks like there's abdominal pain, and I don't know whether that's your diagnosis, or can you look at that for a moment and tell me what you think Mrs. Phillips' problem was when she came into the ER?
I'm sorry.
Could you look at the record, any part of it you need to tell us what you think Mrs. Phillips' problem was when she came into the emergency room?
Object to form. Well, my initial impression is a differential. Not knowing the specific problem, her complaint was abdominal pain. So as you proceed through the history and the physical exam, your differential either expands or contracts or changes. I would probably have a differential, a wide differential for abdominal pain as I'm walking to the room.
Do you have enough knowledge about the case? Did you review the record before you came today?
Reviewed my notes.
Okay,
Yes.
would you just tell us then what your final diagnosis was?
Bowel obstruction due to an intussusception.
Okay, and tell the jury what an intussusception is.
Well, it's a simple visual. It's a telescoping in of the intestines. They kind of fold in on themselves. If I can demonstrate on my sleeve, it would be something like this here, where it just kind of rolls in or folds in on itself, and oftentimes can cause a blockage in that area.
Okay. Do you also evaluate the degree of pain that the patient's in, particularly Mrs. Phillips in this case, when she came into the ER?
Yes.
Can you look at the record and tell the jury what that was?
Initially, she had some minor intermittent pain that became colicky, and then her pain was severe when she came in.
And on a scale of 1 to 10, what is severe?
7 to 10.
Okay. Then I guess you perform certain tests, and I'd like for you to turn to, I believe it's page 1043. Tell us what we're looking at there.
This looks like it may be the CT text questionnaire for the patient.
Do you recall having refreshed your recollection, ordering an image from Mrs. Phillips while she was in the emergency room?
Yes,
And what was the purpose of that?
to help establish potential diagnosis.
Okay. Then let's turn to page 1044, which is the very next page. And that is the only reason that I asked you to look at that. That's an indication that you have ordered the CT, the image, because it says you're the ordering physician. Do you see that?
1044, page 1044.
Yes.
No,
I don't.
that's not me.
I agree. It doesn't look like this page. Look at this page, if you will, Doctor. And that's not the same page, is it?
It is not.
But it is the report where you ordered the CT and the report of the radiologist, is it not?
If it's the same date and time, my name's at the top, yes.
Okay.
Dylan, is that 1045?
No, I'll get this for you, whatever page it is. I thought it was 1044. And then let's look on page, maybe 1045, where it says the report. I think that's the one I was pointing. What
Yes.
page is that?
1045.
1045, okay. So when I handed you this one, 1044, should have been 1045. All right. Then let's look at the next page after that. Is that the report?
Yes, these two pages comprise the report.
And just summarize for the jury what the radiologist reported to you.
Objective form.
That there was a small bowel intussusception with mild dilation caused by that mild obstruction.
Now, as a result of these tests that you had caused to be performed on Mrs. Phillips, what did you decide to do? Admit her to the hospital or send her home, or what did you do?
Admit her to the
Objective
hospital.
form.
Okay. Now, when you admitted her to the hospital, did your responsibility for her care end once she was admitted to the hospital?
That's correct.
Objective
Okay.
form.
Now, when you order an image to be performed on a patient, do you expect to receive those results back and read them? In other words, once it's ordered, who gets the results back?
I get those results back.
You do. Whoever the ordering person is responsible for looking at those results.
Objective form.
Well, sometimes our tests are ordered by triage nurses, so they're ordered under my name. They order them. I get the results. They don't.
Okay, that's what I was asking you. Now, do you know a person by the name of Hepler, who's a physician assistant?
I do.
How long have you known her?
6, 7 years, maybe.
Tell me is she a physician assistant, as far as you know?
I don't know whether she's a physician assistant or a nurse practitioner.
Okay. Tell the jury just briefly what the difference is between a physician assistant and a nurse practitioner.
Objective form.
I'm not sure I would know the total
Okay.
difference.
Just
other-
generally,
other
what's the
than
difference?
Training.
Same objection.
Can he answer the question for
Yes,
you?
he can
Sure,
answer the
fine.
question, but I'd
Thank
like to
you.
get my objection for the record.
You can object all day long, but I'd like to at least answer the question. Tell us generally what the difference is.
I don't know the differences in their training other
Okay.
than one's.
Within their job that they perform, then tell me what the difference is.
Objective form.
I would think it's the same.
Okay. And those either nurse practitioners or physician assistants allowed to order images for patients as well?
Presumably so.
Okay. And when Mrs. Phillips was admitted to the hospital rather than staying in the emergency room, what was your purpose in admitting her to the hospital?
To address her small bowel obstruction
Okay.
or intussusception.
Okay. Now, on the day that you were rendering care to Mrs. Phillips, who were you employed by?
Middle Tennessee emergency physicians.
Okay. And do you often wear some sort of, I call doctor's coats,
Yes.
not like you have today? Take a look at this and see if this is what would be typical of the badge that you wear on your coat.
I don't know if this is exactly what I wear, but similar.
Okay. And what does it say on that badge?
St. Thomas Health, Ascension, Robert Robinson, MD, physician.
Okay. And who'd you say you were employed by?
Middle Tennessee emergency physicians.
That's not on that badge, is it?
That's correct.
Okay. Did you have any conversation with Mrs. Phillips at any time while she was in the emergency room and you were rendering care to her that you were not employed by St. Thomas Health?
I did not.
Okay. That's all I have. Thank you.
Hi there, Dr. Robinson.
Good afternoon.
I'm sorry we're meeting under these circumstances, but I'm going to ask you just a couple questions. My name is Nate Gorman. I represent St. Thomas Midtown Hospital in this matter. All the care and treatment that you rendered to Ms. Phillips was appropriate. Is that correct?
Yes, it was.
And just a minute ago, I think you were asked some questions regarding Ms. Phillips being admitted to St. Thomas Midtown Hospital. Is that correct?
Correct.
And you are not actually the person who admits a patient into St. Thomas Midtown Hospital. Is that correct?
That's correct.
And when Ms. Phillips came in on March, I believe it's 9th, 2016, you obtained a consult with surgery. Is that correct?
Correct.
And the decision whether or not to admit the patient was made by the surgery group or the surgeon. Is that correct?
That's correct.
And that you don't actually have admitting privileges as an emergency room physician.
That's correct.
And I think your testimony earlier was that after the patient was admitted that your care or responsibility for care of the patient ends. Is that correct?
That's correct.
And so after she'd be admitted, it would be another physician's responsibility for her.
Correct.
Kind of jumping topics real quick. You were asked some questions about a physician's assistant and a nurse practitioner. And I believe it was whether or not they have the same responsibilities or same job at the hospital. Is that what you were testifying to just a minute ago?
Yes.
And you're not a physician's assistant or a nurse practitioner, are you?
I am not.
And you don't practice as a nurse practitioner or a physician's assistant?
I do not.
And you were asked a little bit about who your employer was just a minute ago, and that was Middle Tennessee Emergency Physicians, PC. Is that correct?
Yes.
And do you know anything about whether or not a hospital is able to employ an emergency physician or not, or whether or not it has to go through another corporation or something to that effect?
It varies with states, I'm aware.
Okay.
I'm not clear in my particular circumstance.
And you're not here today to criticize any healthcare providers, are you?
I'm not.
And you're not here to offer an opinion on how to treat an intussusception other than referring the patient to surgery.
I'm not.
That's all the questions I have for now, Dr. Robinson. I may have some more after.
I don't have anything else. I'd like to make this Exhibit 2, which is his badge.
All right, that's great.
This marks the end of the deposition. Going off the record, time on the monitor is 1:24.